87% of women don't know that menopause is also linked to gum disease. And 84% of women over 50 have no idea how menopause affects their oral health.
Often we isolate the mouth from the body, but the reality is the mouth speaks for the body. And so things show up first in the mouth. And women in particular, cognitive load is really under discussed.
No one is going to voluntarily tell you that your hormones are impacting your mouth, your gums, all of these things. And that's why I found this to be such a critical and important conversation to have.
The first thing that patients should understand is inflammation. And chronic inflammation, that's a red flag for often systemic problems.
Nobody taught us to connect our bleeding gums to our hormones, or our receding gum line to chronic stress, or the dryness in our mouths to perimenopause. We were told to brush twice a day and show up every 6 months, if we could afford it, if we could get there, or if we had a dentist who actually saw us. But what if your mouth has been trying to tell you something your doctor never thought to ask about? Today, I'm sitting down with Dr. Bridget White, DMD, Princeton and Penn-trained cosmetic and restorative dentist, author, and one of the few people in medicine connecting the dots between what Black women experience hormonally and what is happening inside our mouths. She's the founder of Bright White's Oral Care, and within that line, she created Dr. White's For Her, a toothpaste designed specifically around the needs of women's bodies because she knew the standard formula was never built with us in mind. This is not a dental hygiene conversation. This is a longevity conversation, and your mouth is where it starts. If this is the kind of conversation you need in your life, subscribe and follow so you never miss an episode. This is the Lushness podcast. Let's get into it. Dr. White, I want to start somewhere that I think a lot of women will recognize, right? So you're stressed, you're exhausted, maybe you're in that perimenopause window, where everything feels like it's shifting. And the last thing on your mind is your mouth. Like, I'm just going to be honest, that would be the last thing on my mind, right? But here's what stopped me when I was preparing for this conversation. 87% of women don't know that menopause is also linked to gum disease. And 84% of women over 50 have no idea how menopause affects their oral health at all. So, we're not talking about like a small gap in awareness. That's almost like all of us. And of course, as we always say for Black women, we're always more likely than any other racial or ethnic group to have like periodontal disease. That gap is just a knowledge problem, to be honest. And I think it's like a health crisis hiding in like plain sight, right? We just don't know. So before we get into the science, I want to ask you the question that I think unlocks everything. In your 20 years of practice, at what point did you realize that what was happening in your patient's mouth was actually a window into what was happening inside their bodies?
Wow, that's such a great question. Laura, thank you so much for having me here and to discuss this important topic. For me, it really was pattern recognition. So 20 years of clinical practice, I've had the privilege of working with women throughout my career, but specifically, I worked at a maternal care clinic for 4 years, public health. And I also worked with the military for 3 years where I saw so many women, military moms, military wives, and then my own lived experience, right? So I practiced through pregnancy, I practiced through high stress, grief. And as I am in perimenopause officially, I noticed these changes myself. And so often we isolate the mouth from the body, but the reality is the mouth speaks for the body. And so things show up first in the mouth. So when you see patients, you're looking at inflammation, which is a sign of gum disease, and you're looking at salivary flow. You're listening to stress and lifestyle. And women in particular, cognitive load is really under discussed, okay? So we all have seen the data that Black women specifically actually underreport. We underreport pain. We have less access to care. And then, of course, just there's a lot of data that supports that how we are perceived by our healthcare providers may not be consistent with our actual symptoms. So what I really did is I just started looking and and week after week, day after day, patient after patient, I would listen more closely to these symptoms and I would look at their demographic. I would look at their age group, what they've gone through. And the pattern just was consistent with our biology. Women's biology, it's cyclical. Our hormones are cyclical. It's not linear. And healthcare, especially oral health, is based on a design of the male body, the male biology. And so when you look at women distinctly separate and different and appreciate all the different hormonal fluctuations and then just the irregularities, right? And then also the emotional load. Black women have, we have all these social issues as well as our own biological changes. And I just said it's time for us to really focus on this noise that's happening.
Right. Correct. Correct. And I feel like it's something that no one is going to voluntarily tell you that your hormones are impacting your mouth, your gums, all of these things. And that's why I found this to be such a critical and important conversation to have because, and I've said this even in season 1, I am learning so much myself from all of you of the things that are happening in our bodies due to stress. Like you said, cognitive load, all of those things are literally breaking down. And as you're going through your day and you're thinking, okay, it's just another stressful day, the body literally took a score and it literally is showing up somewhere. We're just too stressed and we're just moving too fast to recognize it. So that's what I really love about hearing that you're saying that these are the things that you've seen that has impacted even just our mouths. So my second question, so most women just go to the dentist, right? But we want to have a good definition of what oral care is. Can you give that in your words? What is the definition of oral care? And how do you feel that we should be paying attention to our mouth?
Well, from the provider standpoint, we look at oral care as whole body care, right? So one thing that is difficult for the society, culturally, Americans, we silo and separate dental from hospital-based care. But the reality is your oral care is mainly prevention. Everything you're doing at home, from brushing your teeth, flossing your contacts, rinsing things away, removing debris from your tongue. There are a lot of cultural remedies, things we do here in the West, but then in the East, things they do, Ayurvedic medicine practices, mouth rinsing and tongue scraping, things like that. Then, on top of what you're doing at home, the prevention is also met in the office. So, we go to the dentist and we have a lot of diagnostic tools. We take x-rays, we do oral cancer screenings. We look at everything, really everything from the lip, where the lip begins, and down to, the throat. So we're looking at the soft tissue, the hard tissue, the movable gum, the gum that looks fixed. We're looking at the structure of the teeth and to appreciate that the tooth, it's somewhat of a rock, right? You're crushing and grinding food, but it's actually an organ. It has different tissue layers. It has a nerve. It has a pulp. It's vascularized. The mouth entirely is very sensory. So often we go through so much chemical and physical and thermal trauma all day, from coffee that's too hot, pizza burns the roof of your tongue, you bite your tongue, the roof of your mouth, excuse me, you may bite your tongue. People are clenching and grinding. They're chewing ice. They're going through all these different thermal. In the morning, we want coffee, but then we want to have a smoothie or a milkshake. So all day long, your teeth are absorbing all of that, as well as the acidic level in the foods and beverages. But what we need to appreciate is when you go to the office and you have that diagnostic workup, you're also going to get coached along with what you're doing at home. And really, you should have a customized care plan. Maybe you're more prone to gum disease, maybe you're more prone to cavities. And that diagnosis needs to also incorporate your age, your gender. Women, you may not be perimenopausal, right? But you've had your menstrual cycle since puberty, right? So we can look at the chart and just like we know all the phases, luteal, follicular, ovulation, at different times of the month, you may have more saliva available, right? Estrogen, our salivary glands have receptors, have hormonal receptors. So when we look at the lifestyle and we're looking at all the different factors that our patient is going through, we want to incorporate tools and encouragement to meet that patient at home because it really is whole body care.
Absolutely. So you hit the nail on the head there because I was going to ask from a longevity lens, like exactly what does that oral health look like for long periods of time, especially when you're talking about the sensitivities of the mouth, the things that the mouth is actually going through. What do you feel through, through longevity, of course, is like the thing that you notice, like with healthy mouths, just great, like, give us some of those things that you look for, because I feel like if we let people know what that looks like, they'll be like, "Huh, my tongue doesn't look like that," or, "Oh, my teeth doesn't kinda," it'll give us more power to understanding what what the dentist sees. Because sometimes you'll explain, and I'm just saying from a standpoint when you go to the dentist, they'll explain, "Okay, you've got a cavity. Okay, I'm noticing that, number 24 is," you hear these things, and some folks are kinda like, "Wait, what is happening?" Depending on if you ask or you don't ask, you don't know what the dentist saw unless it's something that they say you need surgery for this or so from a longevity standpoint, like what does a healthy mouth look
Well,
like?
that's such a good question, Laura. The first thing that patients should understand is inflammation, right? So inflammation, what stands out would be gums that are inflamed, gums that bleed. And chronic inflammation, that is a trouble, that's a red flag for often systemic problems, whether it's early diabetes or proper diabetes, long term diabetes, controlled diabetes, or uncontrolled diabetes. Pregnancy will also, progesterone fluctuations will push more blood to the gums. And then you also need to consider medications, right? So whether it is, pharmaceuticals are going to influence salivary flow or retention of plaque. So when we see inflammation that's not minor. Everybody has a little bit, especially if they're not going to the dentist, going to the dentist every 6 months. But if we see an alarming amount of inflammation, then we really want to dig deeper and talk to the patient about what they're doing at home. We discuss medical histories. A lot of times patients are like, why do you need to know my medical history? What does it matter? But that has everything to do with your health and your oral health. So, yes, we want to look at our tongue. Everybody has a unique, just like, but we look for patterns. So, our tongue should be, it should be smooth. We want to appreciate where our taste buds are. We want to look at habits. Are you a smoker? Now, smoking is just a jump off. Are you vaping? Are you doing hookah? Are you chewing tobacco? There's so many different products that patients use that they don't realize actually have oral health implications. We want to talk about salivary flow. Saliva is the protector of the mouth. It used to be surfing in there. When I get in there, I should be like, whoa, there's so much saliva. That's what we like. Saliva neutralizes and protects. In the best case, saliva is mainly water. Some people, they may have a more higher concentration of protein in their saliva. So people forget that our mouth is actually the entrance to our gut. So the bacteria level, there needs to be some. Our mouth is its own ecosystem. So often you may hear the term oral microbiome, and it sounds so technical, scary, but that's our mouth is actually a place where it homes fungi and bacteria, viruses, cells, microorganisms. They need to be in a nice balance, just like your gut, right? So I always say, think about a baby. A baby comes into the world and they have that sterile gut and they're whiny and cranky. And until they get enough bacteria in there, then they're not going to be able to have a healthy immune system. And that takes a few months. So that's what's important. We look for the gums. The health of the gums is the big indication of overall health. And then, of course, we look carefully at the teeth, not just for cavities, but for wear patterns. There are patients that may clench or grind their teeth. So, clenching may be okay at a stop sign, but if you're clenching all day because you're taking care of your aging relative or you're dealing with a lot of social issues or unemployment. I mean, we can't ignore what's going on in the society. That has oral health implications. It can also lead to joint pain. So people always think about their wrists and their knees and their hips, but this TMJ, this joint here where our lower jaw attaches to our skull is so dynamic. So sometimes we're putting so much pressure that we get inflammation of our joints, but we also need to understand our muscles. Like all these muscles, there's so many different muscles that impact chewing and function. So It really is a dynamic place. There's a lot going on in the mouth.
Yeah, I see. I mean, and that's so it's so interesting. I'm loving this conversation because this is something that no one tells us. So, and I just want to tap on this a little bit because you've mentioned hormones, you've mentioned menopause and perimenopause. What about cortisol directly impacting the mouth? Like, is there anything, any patterns? Is it similar? Of course, it's considered inflammation as well when there's raised levels in the body, but is it the same pattern with cortisol directly in the mouth?
Absolutely. Actually, there's a term I call cortisol clinch, where you're like, we don't realize that our jaw takes on a lot of stress. There are studies that actually link the stress and the wear on the jaw in women to also the pelvis. So, yeah, there's some right. It's amazing, and it sometimes it's perceived as silent. It can be there's some patients that they press their muscle. They may clench their teeth. They may wear their teeth in certain patterns. And then while cortisol is a stress hormone, it's really important. We need to understand what it does. It puts us in fight or flight. It affects our sympathetic nervous system where we feel like there's a monster outside the cage. And if you think about that, that's not healthy, right? So that means that your nervous system needs to be regulated better. And then another issue with cortisol is that by itself or in a male pattern, it may act one way, but when cortisol intersects with progesterone and estrogen, it acts very, very differently. So that's why it really is multifactorial.
Wow. Yeah, this is really, really good to hear. So, when, let's say, for example, Black women patients, what are you hearing, directly from them when they're coming in pertaining to anything? Is there any patterns that you're noticing that brings them in more? Is it when they're perimenopausal? Is it when they are in full menopause? Is it just high stress? Like, what are you seeing commonly?
Well, I've had the privilege of treating the Black population, Black women, my whole life, luckily, and that was one of the reasons I pursued oral health because I knew that there was a shortage, especially, there are probably, I think they're not even 6% of dentists are Black. And so, the workforce is not, doesn't have parity with the population. So with Black women, again, sadly, we underreport. I look at things that have been tolerated too long. But one thing I want to talk about today is that, especially in the Black community, uh, it's not just fear of the dentist and shame and pain, it is that limited access to care. And I've had patients who would talk about maybe going to public clinics when they were younger. And we have to appreciate even our eldest patients have, especially in Washington, D.C., Virginia, where I live, they had memories of being treated at offices where they had to use back doors. We have to remember that in parts of the country, at one point, if you couldn't find a Black dentist, you had to go to the vet. And so our access to care, yeah, sadly, that's just our history here in this country. And when you look at that limited access to care and you look at shame and fear and pain, I have seen Black women who have shown up, they're missing teeth, or they feel so overwhelmed by trying to they'll say, I got to get my mouth together. And they're giving me all this information, and I'm trying to narrow the conversation to talk about, like, to give them their confidence, right? And so establishing that trust in that relationship of trust is really the start to good care and what they're doing at home. But sadly, that really is it. A lot of patients, they'll wait too long. And so that's why this information is really important for younger women, especially, to know that the first signs of trouble, if you're brushing and you see blood, that's not healthy. You should, hopefully, your employment offers dental, but maybe go on the marketplace and see if you can get your own dental plan. Reach out to dental offices and see what kind of health insurance they even offer. Some offices will work with you if you don't have proper dental insurance. So, yeah, sadly, I would say it is that, I guess they'll say the auntie age, right? Like 50, 55, where now you've gone all these decades with that limited access to care. You lost some teeth early, and now we're trying to rehab, but attached to all of that is shame. And we can another topic I'm sure that you've covered or will cover soon is, how we're judged on our appearance, especially Black women. Our hair and I mean, everything is a discovery process, right? And so we can't ignore the fact that our smiles are often judged too, especially very harshly when you're.
This is this is amazing, and the reason why I find this to be so amazing is because I think in my big grown age, all I do is look for Black women as for this very reason. It's the only and I'm gonna go on the record and say that it is one of the main reasons that I do this, because it is mind-boggling to me that fear is the only reason why we're not taking care of our mouth. Like, it just doesn't sit right with me. It doesn't sit right at all. And that's why I thank you for what you do. Thank you for your representation. Thank you for being here. This is why we're able to do what we do, because trusting faces is what we need in the medical field. Like, we just need to feel like, okay, she gets me, or, he gets me. We have to see this representation, because this is really wrong, that this is one of the main reasons women are coming in with missing teeth and, just bad orca, because they're just afraid, and I'm so glad that we're having this conversation. Thank you for that transparency and that honesty, because the more we can get people to understand, like, hey, look for someone that looks like you. I've heard that previously all the time from some of our other guests. Like, if that's really where the fear comes in, start there first. Start looking for a dentist, anything that looks like you, to take away that stigma of, of pain, of fear, of pain. Like, we don't deserve that. And so that's why I'm glad that you mentioned that. I'm glad that we touched base on that, because it's important. That's so important. So, okay, because I'll go on my soapbox. I'll sit here and talk all day about why we need more and we deserve more, because we do. But, I think that that was great to mention. So that leads me into my next question. Any woman who's listening today who's like, you know what, let me just go ahead and take my dental health serious, my oral health, excuse me. Let me take my oral health seriously. Besides just finding someone that looks like them, what are some of the key things that they should be looking for when they go to find out about their oral care, even when it comes down to their hormones? Some of the things that they should be maybe letting their dentist know. What are some of those things, so that way we can give that power to, because of course fear is like an energy, right? When you do something, it goes away. It's one of the first thing that goes away when you do it. So if we've got women going in and doing it, but they're also empowered with understanding what they should be asking, please let us know what that oral care questions, anything about our hormones that we should be mentioning, that would give, a bird's eye view of exactly what's going on in our bodies.
Yeah, I mean, like I said, your overall health, right? So one thing that I'm sure you recall, you go into the dental office and you fill out a medical history. So there are going to be questions about general diseases, the big ones, right? They may ask you questions, social habits, recreational drugs, smoking, things like that. But not what I don't see is an area for hormones or for women's health status, right? And I think that that is going to change. Number one, there are more women emerging in the profession. Now dental schools are 65, 60, above 60% female. Imagine. The caveat is, we still have dentists, boomer dentists practicing, but the average dentist under the age of 40, half of them are women. And so, because women have the lived experience and now they're going through these hormonal changes themselves, the women they'll be more investigating hormones and talking to patients. Traditionally, and the American Dental Association has said a lot of dentists don't feel comfortable addressing hormones. And let's just based on the data we just discussed, most they're still heavily male. And so now you're having a man, unless it's pregnancy. Pregnancy is the happy space. Oh, you're pregnant. Oh, you might have something called pregnancy gingivitis, but sometimes they don't even go deeper. I had hyperemesis throughout my whole pregnancy, with and without vomiting. So when we have nausea, even just the acid coming up from our stomach, but certainly vomiting, that acid rinses up on our teeth in a certain pattern. Patients need to understand they shouldn't brush right away. So oral hygiene during pregnancy, not just because of inflammation, but because of behavior and hormonal fluctuations that cause certain changes in your lifestyle. Sometimes women are tired. I mean, tired and then pregnant and taking care of other people. They might not be brushing right before naps or bedtime. And women have a higher risk of decay in general, right? So I think that we need to understand that women have to advocate for themselves. So when you get into that visit, I mean, sometimes, you don't wanna overwhelm the provider, but it's okay to have a few notes. And especially if you're going through if you know that you have entered, perimenopause. I think Dr. Malone, she said it could be for Black women, it could be 16 years. It's not like, well, today I'm in menopause, y'all." It could be so many things that have that begin, and you need to be the reporter for your own health, right? And if you don't feel comfortable, providers across the field, especially family physicians, always say, bring an advocate, bring a friend, bring a colleague, bring someone who can remind you or write it down. I think that we're at an interesting time, in terms of the changes and the technology and the emerging populations, but we also have a lot of our fears are legitimized by our experiences, by the experiences that have been documented, those that are shared with us. But in general, healthcare should be a safe space, period. That should be the norm. That should be normalized, right? And so if you number one, if you don't feel safe, you should look for another provider. And then again, I would say, bringing an advocate. And then if it's not, it may not necessarily be the doctor, may not be the dentist, maybe the hygienist, maybe someone at the front desk who helped you make your appointment. Once you notice someone that makes you feel comfortable, reach out to them and let them know you're a little anxious, especially if it's been a while. And believe it or not, that's entirely normal. Every day we have patients who say, I haven't been here in a while. They say patients would rather talk to the IRS than the dentist. So
Yes, yes. And to share a personal story, it was like pulling teeth. Yes, the pun is intended and it was corny, but I threw it anyway. But pun intended, my husband, he deathly afraid of the dentist. Deathly afraid. Last visits, before we met was like as a kid getting like that pain. He never forgot it. And so it's like now, oh gosh, I mean, he's an advocate for his own health now. Now he's going everywhere. And I think that it just takes the right type of practitioner, the right type of person that you do your due diligence, you do your research, and you find the person that makes you feel all right. I love that he gets black male doctors for his prostate checks. I love that he's very proactive with it. And so and that's just a personal tidbit, but how important that can empower you in your health. And I love that you mentioned that. And one of the things that I wanted to ask about is, when we talk about oral health overall and we're talking about the hormones, I want to get into the conversation about you with that hormone mouth. I want to know more about that. That was something that was very intriguing to me. And I'm also going to get into your dental care brand as well because I'm so excited about that as well. And I love that you're such a triple threat. Like I love that you put your money where your mouth is. Another stupid pun, but it's staying. It's
love that.
staying. It's staying. I don't care. Call me corny. It's staying. But but I do love, that you really have done that. So tell me a little bit more about there's research linking periodontal disease to Alzheimer's. I think that is something that women don't even realize as well. So I want to talk a little bit more about that. More about oral health and those type of diseases that tend to manifest. If we're just paying attention to this early on, we can offset, like you said, disease is normally the things that we want to make sure that what we're doing is preventative. So tell me a little bit about those ties. Of course, because those type of diseases do impact longevity, and one of the episodes that I previously did, I love when one of our doctors basically said, you could be bedbound. You could be in a wheelchair living long. So you want quality in that in that long living and that longevity. So talk to me a little bit about those diseases that tend to manifest as we get older that are showing up in the
Oh, yeah,
mouth.
definitely. That's such a good topic. The association between oral health and systemic health. You asked about Alzheimer's, and essentially, it's not necessarily that dental disease causes neurological conditions, but it's more that they're associated, right? So, of course, we always think of pregnancy, we always think diabetes and heart disease are also big ones. It's just important to understand how the body works. And that's why oral health is whole body health. And it's really about chronic inflammation. So, chronic inflammation is caused by bacteria that festers too long. And that bacteria can get into our bloodstream. It can lead to our heart. And it can also, travel down into our gut and cause problems. And so, in terms of a lot of the data, a lot of these studies are looking at patients over the longevity of their life, right? And so, as patients age, when we see things manifest, when patients come in, we are looking at everything, especially inflammation. Inflammation is essentially bacteria that has festered too long, that has stayed too long, and the gums are inflamed and they start to bleed. The red blood cells want to help. Your body wants to correct itself. But if you're otherwise saying that you are brushing and flossing at home and your medical history is clear and we see this chronic uncontrolled inflammation, we're actually going to direct you to your physician so they can do some investigative work and look a little closer and see if there's something silent that could be brewing inside your system. And that's why it's important to understand that oral health is whole body health. The oral systemic link has always been there. It's not new. Now with more media and more awareness and then also more advocacy and access, women have more access today than they've ever had. I mean, I always say the millennial woman, she's going to change the game, especially in dentistry. Dentistry becoming more heavily female is going to change how we work. It's going to change how our patients are perceived and treated because now women have that lived experience to share.
I love that. That sounds so good. Yes, I need that. I need that to happen. I need that to happen for our community, especially. Just more women that look like us, understand us, study us. They make it their life's work, just like you did, and that leads me into Bright White's oral care. First of all, congratulations on a beautiful brand. I would love for you to talk more about it. And specifically, you created a toothpaste, a women's line of toothpaste for our mouth specifically. And I want to talk about that because that is so exciting to hear that you took the time to make something that was directly for women. So tell me
Yeah,
about it.
thank you so much for mentioning Bright Whites. Right now, our premier product is Dr. White's toothpaste, and it's really a fruit forward brand, and that's what distinguishes it from our traditional big toothpaste companies, where mint is everywhere. And it's really, I'm kind of like, who told you mint was the bomb, was the jump up? Mint actually is very aggressive in the mouth, and that's why I wanted something that was a little softer, a little more gentle, and also joyous. And fruit, culturally, fruit is everything. It makes you feel good. It hydrates. It has so many natural remedies. Fruit has been used across cultures. In the South Pacific, they chew on coconut husks, for its antimicrobial properties. Lauric acid is in coconut. It's used for oil pulling in parts of Southeast Asia. We do it here now as well. So it's important, for me, it was like sensory and having women take ownership of their oral care. And I felt like I love that I see patients, but I only see them in the best case twice a year. Those other 363 days, you're in the oral care aisle. What are you using at home? And I thought this is a perfect space to have products that are ritualistic, are cultural, and yeah, why not made by a woman? So I felt like it was a perfect opportunity. And yes, we have products emerging soon that are specifically for symptoms and experiences that women have. I don't know, Sean, how far I can go with that, but
Yes, please talk about it because this is so exciting. I'm loving this because I've never heard this before. You always see like hello or boca and things like that, and they're just you get mint, but they call it like something like an exotic
Oh,
kind of
right.
mint. And you're
Yeah,
like,
yeah.
child, that's mint.
Oh,
That's
that
mint,
is
but
yeah, yeah,
it's true. Yeah,
yeah.
exactly. And my thing is, we always shop for our toothpaste based on what they do for
Oh,
our mouth,
right,
right?
right.
Do they whiten teeth? Do they But to hear that we're turning this into something ritualistic, especially for the fact that we're talking about what black women are going through as far as being afraid, again, more putting power into your hands, buying from brands that thought of you first before the profit margins. This is what's important. This is so please
Well
talk about
well,
it.
one big difference is, so our products are fluoride free. They do offer a remineralization ingredient called hydroxyapatite, which is actually what our teeth are made of. And we all know that fluoride is the most researched preventive tool. And it's not to take away the benefits that fluoride provide many people. But for me, I wanted patients to have a little more of a customized, personalized approach to their oral care. And just like our skin and our hair and our makeup, why not have a variety of tools in your oral care arsenal? Why not? And then my toothpaste also has a unique sensitivity relief blend, and it's all based on botanicals, panel extract, which is from trees from root, and it provides like anti-sensitivity benefits. It also has neem, an ingredient that's used in Southeast Asia. A lot of people use it in gardening. It provides a lot of relief for our gums. It has theobromine, which is in chocolate, dark chocolate, cacao, and it actually hardens our teeth. I don't know if you ever have dark chocolate and it feels chalky, your teeth feel a little chalky. That's the theobromine. And then also understanding like the chemistry of our mouth. People always think like my toothpaste. But remember, we've talked about the oral microbiome. We talked about what you're eating. So your mouth, in the best case, saliva neutralizes, but what we eat, acidic foods and beverages, stress, drying the mouth, that creates an acidic environment. So we also have arginine, which is an amino acid that helps to keep the pH neutral so that everything can really work and be healthy. The mouth could be a healthier environment for long-term health. Yeah.
I love it. I'm proud of you, Dr. White. That's amazing.
Yeah.
I'm proud of you. I'm here for women who are building real things and are able to help so much. I hope that listeners hear this and understand that the horizons are changing. We're getting smarter, we're getting more knowledgeable, we're understanding what's available to us. We have choices. I think that the empowerment in owning your oral history, your oral health, all of those things allow you to be so much more free in walking into a dental office and understanding what that is. If you could leave our listeners with one important piece of information that you hope that they take with them and they remember that it came from you, what would it be?
I would say that your smile, just like smiling makes you live longer. Smiling itself makes you feel better. It makes your audience feel better, and that's why I want your smile to taste like joy. It should feel joyous. So that means that your oral care at home should be joyous, and your experience with your oral health team should be positive. And that is starting from wherever you are. Always looking at that next step. Come next time you go into the office, you should have 3 questions. Why are my gums doing this? Whether it's food felt tasted funny, that's a thing. Metallic tasting food. Our hormones are dynamic, and many providers, they don't know that. They just don't have that lived experience, or they have been trained to isolate it to very, very distinct um experiences that women have.
Absolutely. Dr. White, thank you so much for your time. This was wonderful. I absolutely enjoyed this. I think that I not I think what I pray and I hope is that everyone walks away understanding that we don't have to be afraid. We've got great things on the horizon coming for us. Empowerment, women taking over the dentistry industry. I would love to see it so that we have that more, because women are innately maternal. We're just a little bit more understanding, and that's going to help a lot of people feel like, wow, that visit made me actually feel
Yeah,
good. Like
yes,
I actually,
yes.
like I felt like she
Yes,
heard me.
you should feel, but after your teeth cleaning, that's one thing patients say, "I feel fresh." Yes, we've removed active bacteria. It's actually like it's a disease prevention therapy. It's not just that's why, look, if all you had to do is brush and floss, then I'd be out of business, right? So,
Exactly. I love it. Thank you so much for joining us
thank you
today.
for having me, Laura. This is great.